Welcome back. I'm not sure what happened to my previous video, but it wouldn't record all the way through. So we will continue here on, this would be part 3 on checking and assessing for the pulse. So we're going to pick up on factors affecting the pulse. Please look at all these different factors, and I'm going to go to your book, so continue to have your book open. Okay, so I wanted to point this out before I continue. This is a clinical alert. Never press both. Now let's look at when we should assess for a pulse. Before giving medications that could affect the heart rate, obtaining a baseline, with routine vital signs, any change in the patient condition. So when you walk in, you're going to get your baseline, do your assessment, and with that assessment includes your vital signs. If you see a change in your patient's condition, you're going to reassess your patient, reassess your assessment, and include your vital signs with your assessment. Medications, certain medications, we need to take vital signs prior to giving certain medications, i.e. blood pressure medications, and especially heart medications as well. Look at this slide. This is the normal that I will be going by, and the terminology. If it's over 100, it's considered fast, tachycardia. Less than 60, considered slow, bradycardia. So therefore your normal is 60 to 100 beats per minute. That's BPM, beats per minute. When we're checking the pulse, we also checking to see if it's a bounding pulse. Or we checking to see if the pulse is weak or thready. When we're unable to palpate for the pulse, we get an ultrasound machine, or what we call a little small Doppler, and we put it over the area where normally our fingers would be to assess and to hear the noise for the pulse. And if you don't know how to do it, we can always ask the nurses that are there to show us how to do it. This is one of the Doppler ultrasounds. Some have Doppler ultrasound stethoscopes as well. This is one of the Doppler ultrasound, and I just wanted to point that out to you. And that last two sentences, detects movements of red blood cells through a blood vessel. Okay. Make sure you are aware of the following when checking a patient's pulse. Very important, any medications that can affect the heart rate. As you read through these, remember when someone comes in and they've been active, you need to make sure they wait for 10 to 15 minutes until the client has rested and the pulse has slowed to its usual rate. Read the other bullet points, and this is very important. Now I wanted to point out the equipment that we need. Please read this. I also post an announcement that everyone needs to have a watch with a second hand. So look at here regarding your equipment that you need for assessing a pulse and taking a pulse. I wanted to point out the apical pulse assessment and this paragraph that I got out of your book that's on page 491. I want to make sure that you read this and you understand it, and write down questions for me when you get to class if you have any after reading this. We're not going to focus in this class on any newborn assessment, infants, or children, because you will get that information during your pediatric rotation. This is very important in assessing your patient's pulse. So when you do assess, look what you're assessing for. You're assessing for signs of cardiovascular alteration. So when you're starting to work on your concept map and you're trying to wonder, what are signs of cardiovascular alteration? Dyspnea, that's difficult with respirations, patients having a hard time breathing. Their fatigue or weakness. This is all, is their heart pumping good enough? Pallor, if they're cyanotic or cyanosis, that means they get bluish discoloration around their mouth, their mucous membranes, and even sometimes their nail beds. They have palpitations, they're feeling faint. You know, they're not getting good circulation, good blood flow. Impaired peripheral tissue perfusions as evidenced by skin discoloration and cool temperatures. So when you're touching the skin is cool to touch. And here are some factors that may alter the pulse rate. Now what I just talked to you was about the apical pulse and how you assess it. Also, look at this. This is the purpose. So you're assessing an apical pulse. Now here's the purpose. Read these bullet points to look at the purpose. Now what I spoke to you earlier was more of page, I forget what page I was on, but this was when you are assessing. You have your purpose. Let me click on here so I don't go too fast. And then under your assessment, this is what you're assessing for. Okay? And don't forget about the factors that may alter the pulse rate. Now, I know that some of us came with some medical background and some of us came with absolutely zero, which is perfectly fine also. So I want to make sure that we don't overlook how or what is a heartbeat. It's like, okay, what am I listening to? It's your lub-dub. So when you hear boom, boom, that's lub-dub. That's counted as one beat, not boom, boom being two. Boom, boom, lub-dub is one beat. Okay, so read this paragraph. Let me know if you have any questions. And remember that you are to count for 1 full minute when you're checking the apical pulse. I am aware, and you guys should be aware, that your first 9 weeks of nursing, we will not do drugs, past medications. But I saw this in your book and thought this was really important for you to know. I will definitely not test you on it, but it's good information to know. Well, we made it to respirations. Let's talk about respirations. Add oxygen, remove carbon dioxide, maintain homeostasis. That's our blood pH. Bring out your book because I got some pages to reference. Now, as we talk about respirations, turn to page 496. So look at us as we read on respirations. What is respirations? It is the act of breathing when we take a deep breath in, or taking a deep breath also is inspiration. So it refers to the intake of air into our lungs. And here, if you stop and pause, take a deep breath in, you see how your chest wall gets a little bigger, and you let it out. Exhalation, when you're letting the air out, or expiration. Exhalation or expiration refers to breathing out or the movement of gases from the lungs to the atmosphere. Ventilation is also used to refer to the movement of air in and out of the lungs. Ventilation, okay? And then there are basically 2 types of breathing. You have thoracic breathing and you have abdominal breathing or diaphragmatic breathing. And you can tell that when you look at your patients, when you're assessing, are you seeing the chest rise and fall? Are you seeing the stomach going back and forth? So we'll continue to learn more about that. And also make sure you look at and read your ATI and view your ATI videos. Please read this as I thought I would add a little anatomy and physiology for you, something that you learned way back, or if you just took the class. Make sure you read this so it reminds you about the respiratory and how it's controlled and what controls it and where it's located. So when things happen to your patient, you can see why it's happening and what else is going on with them. I'm trying not to get too in detail. As you read Assessing Respirations, I just wanted to add that make sure when you're checking a patient's respiration, sometimes it's wise to hold the hand over the chest or over the stomach area, as if you're checking the patient's pulse, so they don't control the respirations when they know that you're checking the respirations, okay? Because patients will control, hold their breath, breathe, different types. But if you say, oh, I'm just checking your pulse, and you hold their, put your fingers over the radial pulse as if you're checking it, but actually you're watching the chest rise and fall. Just as we assess the pulse for the rate and the rhythm, look what we're assessing the respirations for. The rate, the depth, rhythm, the quality, effectiveness of respirations should be assessed. Okay? I'm not sure if I had this in your terminology quiz today, but look at your words that you do need to know. Okay? These are very important. As we continue to look at respirations, I want you to pay close attention to this slide with the normal rates. 12 to 20 breaths per minute is normal. Fast breathing, 24 and above. Slow breathing, 10 or less. Bradypnea, tachypnea, and apnea, absence of breathing. Count for 1 full minute. I know most of you are all aware, but sometimes this can be overlooked. I just wanted to reinforce breathing. So we breathe in oxygen and we breathe out carbon dioxide. Okay, we breathe in, we breathe out. Okay, so we breathe in oxygen from the air into our blood, and the release of carbon dioxide from the blood into expired air. Okay, the amount of hemoglobin in the arterial blood that is saturated with oxygen can be measured indirectly through a pulse oximetry. That's the little gadget that we put on the finger, sometimes the forehead, sometimes the earlobes. Okay, and as you read here, you see it provides a digital readout of both the client's pulse rate and oxygen saturation. Vital signs. When we talk about vital signs, pain is the 5th vital sign, but there is studies going on now. They're going to start including O2 saturation as the 6th vital sign. So we're just going to jump on board with it now and continue it throughout our nursing practice. As I scroll through assessing respirations, this is also taken directly from your book. Please pause, rewind, so you can look at the purpose. I want you, under the assessment, what you're assessing for, okay? We're not going to go too much in the one in the blue, but I want to make sure that you look for those things. Now here are some factors that can affect your breathing. Exercise, stress, increased temperature, low oxygen concentration. If you have any questions regarding this, read the chapter in your book, and if you continue to have questions, feel free to ask me during lecture. As I end, I just wanted to scroll through here. I didn't want to leave this out. It's not in the PowerPoint, but I wanted to make sure that you saw this from the book. And I just wanted to scroll through things that you should know. Just make it part of your everyday assessment. And we end our assessment with our documentation: respiratory rate, the depth, rhythm, and character on the appropriate record sheet or in the electronic medical record. Thank you for listening. Stay tuned for the next part of blood pressures. Take care. This is only 13 minutes. Hopefully I didn't put anyone to sleep. Thank you.